Hey everybody, Will Brink here at brinkzone.com. I'm going to do a short talk on COVID-19, complications thereof, and how I think a large percentage of the medical profession is missing a primary window of opportunity for treatment with the complications of COVID. I wrote an extensive article going into full details here, so don't worry if you miss anything. This talk will be a little on the complicated side, so I'm going to go kind of fast. So if you're not science literate, I guess is the term, or what have you, some of these terms might be a little bit much. I will link the article, which I wrote in March. I've updated it about 4 times now because data continues to come out. Frankly, really supporting the recs that I made early. So I'm going to go through this. Try to go through this pretty quickly, and hopefully you can see what I have on the whiteboard here to outline what I think is a major hole in the treatment of the complications of COVID. So first, let me start off by saying that remember, a very small percentage of people, again hovering around 1%. Those numbers will go up and down as time goes on. But let's call it 1% for now. About 1% of the people that get themselves hospitalized and have serious complications to COVID and pass away and all that. So it's not a big number, but of course 1% sounds like a small number when you're adding 1 million people and 10 million people and 100 million people. Those numbers go up pretty fast. So I just want to say that about that. It's not like it has a high mortality rate, but for those people that do get themselves in trouble. I'm going to cover some important facts here, and like I say, I will link the article, which does have a ton of references and sources and explanations for people that want to really get into it. That is, if they've got a science background, they are medical professionals, they know medical professionals, I want to send this on. But the article's kind of deep too, and so doing it as a visual, some people learn better, respond better to visual stuff like this, and so I'm going to do this, I'd say, hopefully fairly quickly. I'll try to answer questions in the text section under the vid if I can, but understand that this is not going to be a simple talk per se. I'm going to do my best, okay? What I'm going to do is I'm going to go a bit backwards. I've been working on this model as simple as it looks. There's only 1, 2, 3, 4 parts to this basic model. Of course, under the hood of all of these things, there's an awful lot of things, a lot of science going on. But I'm not going to get into that. The article does get into that a bit more. But I've been working on this basic model of the cause and effect of COVID complications. That is what starts it, and there's a cascade effect, of course, that goes down the line to end up being complications, i.e. Sepsis, and that such. So again, there's a whole list of complications on the article. I'm going to go backwards from the complications part and work my way back to what I think is actually the initiator of all these problems that is not really getting addressed from what I'm seeing. And I do read the literature pretty much all day. I do communicate with a lot of medical professionals in my line of work and so forth. With some exceptions for sure. Not painting all medical professionals and all hospitals and all places as all doing the same thing, because they, a lot of times they do have their own approaches. So here we go. So, all right, so we're going to start with complications, right? There are a lot of known complications to COVID. Well, how do the complications come about? Basically, what they have is what we call comorbidities. Those with comorbidities such as obesity and heart disease, of course, even age is a comorbidity. I think it's over 65, but it moves around a little bit as to where there's a sharp increase in complications. The list of comorbidities, diabetes is another one, but those are groups of people that have much higher risk of having complications from COVID, and that you'll find in the article too. But these are basically the complications. This is the part you're trying to avoid, obviously, okay? Where do those complications come from? The complications, basically for the most part, come from what they call a cytokine storm, or what a cytokine storm is, and I'm sure you've heard the term, is basically a hyperimmune effect, a hyperimmune response. Apparently not all hyperimmune responses are necessarily cytokine storms, but again, we're going to generalize things best I can here. But a cytokine storm, now what are cytokines? Cytokine is a sort of a family of highly reactive compounds that your body makes that is involved in immunity and a million other things, some of which are known and some of which are still actually being figured out. But there's things like interleukins and TNF alpha and so forth. Again, article does have a list of some of those cytokines, but think of it, cytokines are made from fatty acids, generally speaking, highly unsaturated fatty acids. You eat omega-3s and omega-6s, they go down different pathways, they can get made into a variety of anti-inflammatory, pro-inflammatory cytokines. It's a big family of compounds that the human body produces. So again, this is a very generalized explanation I'm giving you of what cytokines are. But cytokine storm, when they say cytokines or cytokine storm, there's an overproduction of highly inflammatory cytokines in that family, IL-6, TNF alpha, and so forth. And that, of course, what happens is those cytokines, that inflammatory response, that over-the-top inflammatory response, damages tissues. It damages, well, lung tissue especially, and COVID, of course, is a respiratory virus, which goes specifically after the lung tissue. But lung tissue is very sensitive to inflammation, as is the brain, and so forth. So that's cytokine storm. I'm going backwards. It's going to go. We'll get to it, so don't worry about it. All right. ROS, reactive oxygen species. Reactive oxygen species are, again, highly active, reactive compounds the body produces from a number. They're oxidizers. That is pro-oxidation. When you hear the word pro-oxidation, you heard the word, of course, antioxidants, pro-oxidants. ROS, reactive oxygen species, again, there's a family of those the body can produce that are highly reactive and will cause an immune response. And so you'll see where I'm going with this. Okay, finally we are going to, you'll notice the arrows are going this way, so bear with me, but I wanted to go honestly from the more serious part to less serious on this cascade. So you'll see the arrows are going this way. So oxidative stress, OS stands for oxidative stress. I'm sure a lot of you are familiar with oxidative stress. You've heard the term before. You take antioxidants to combat oxidative stress. Oxidants or pro-oxidants are free radicals. There's a variety of ways of talking about them. Are involved in disease processes and a lot of other things that we know that oxidative stress, to some degree or another, is involved in things like heart disease and cancer and so forth. But they're also not just oxidative products or free radicals, also just not automatic bad guys. They are used in, the immune system uses them to attack bacteria and viruses and stuff. So the issue, of course, is balance. As always, the issue comes down to balance. You're not looking to, if you were to actually take some synthetic antioxidant that shut down your oxidation reactions, you'd die. So put it that way. All right, so basically I want to go complications from COVID. The doctors, the medical professionals, those people in the hospital and so forth that are addressing these complications, are doing, obviously doing the best they can. We're talking about, remember, we are talking about what they refer to as a novel virus, which means, in basic English, we don't know that much about it. It's novel. Hence, there's unfortunately a lot of research that has to be done to understand unfortunately, the learning curve of treating this virus has been very steep. Of course, they've been able to rely on their knowledge of similar viruses and what's worked in the past and so forth, but the treatment of complications has gotten much better. I think we're already seeing the mortality rates are falling somewhat due to that. There's a lot of moving parts here, but one of the reasons that we are seeing lower mortality rates is that the hospitals and so forth are catching up pretty quick to dealing with those complications as best they can. And they've done a pretty, honestly, all things considered, they've done a pretty bang up job. As always, with any hospital, with any clinic, with any doctor, the quality of that treatment probably ranges quite a bit. Some of them are probably right on the cutting edge of what's working and isn't, and some may be stuck in a rut and doing the same thing they were doing before and not having a lot of success. There is, I think, a lot of communication going on also at this point, a lot more than there used to be because of course the internet and websites and so forth, and CDC is posting stuff and so forth. So they're pretty good at that. But why we don't want to get there. The whole point of this talk is to avoid that. You don't ever want to get there if you can avoid it. Okay? Cytokine storm. Obviously, you are, of course, now they're pretty good at that. Cytokine storm is pretty well recognized as being heavily involved or with the complications that ends up with COVID, right? This is pretty well established. This is not news to the medical professionals or anything. I'm not telling them anything they don't know per se. Testing, of course, how early do they test? How are they identifying cytokine storm and stuff is another discussion for another day. There's a number of ways they can look at that, but again, I'm not telling them anything they don't know. This is where things start to get. Things to get a little fuzzy when we're talking about mainstream medicine and how they treat this COVID specifically. This stuff is involved in a lot of illness and disease and stuff in humans, but we're going to stick to COVID. Okay, so reactive oxygen species, this is something, again, not going to be news or a term that most medical professionals have not heard during medical school and so forth. Depending on their specialty, their area of focus, they'll be either much more familiar with that term or researching what they do, how they do it, how they work, and so forth. And no doubt some of them are a whole lot more better read on it than I am. But this is not a term per se that is news to them. However, the role of reactive oxygen species in cytokine storm that goes into complications, however, is just starting to get maybe the traction and the attention it deserves. But it's really, again, some papers. There's a paper I just posted, came out like a few weeks ago, getting into the weeds about the impact of ROS, reactive oxygen species, to cytokine storm and so forth. But this is not, something that they really focus on per se. And here's where the blind spot. This is the major blind spot that we're going to get to, where I feel, for the most part, that the medical profession at large, writ large, is missing the boat. This is where I think they're really, really missing the boat. Again, this is not all of them. There are some very smart docs out there that are on board with this, but my understanding, again, from is very hit or miss as far as whether they are actually dealing with that oxidative stress. And this is where it all starts, in my view. This is my model. Some people might think it's actually pretty simple and go, oh, yeah, gee, well, what? I could have figured that out. Well, you didn't. And to be honest with you, I haven't read that specific model too many other places as I've written it out, and I hope figured something out. But why? So this is the blind spot, right? Why is this a blind spot to most doctors? Now, again, the term oxidative stress, again, let me repeat, that's not a new term to them. They know what that means. It's something you would have heard in medical school. And depending on, again, where their specialty and area of focus is, this may be something they're very familiar with and work with and try to combat and recognize as having an important role and so forth. But not as much as you may think, again, in terms of, maybe more of your alternative docs and so forth they recognize it. You will see the terms oxidative stress. But writ large, in major hospitals, in clinics, and so that are dealing with COVID, I don't think it is a large percentage. I think it's a pretty small percentage, frankly. Now, why is that? Well, they'll know the term oxidative stress, but how do you deal with oxidative stress? This is where you have problems in their world. You deal with oxidative stress through, of course, antioxidants. Antioxidants, at least in medical school and in basic going forward, is the realm of nutrition. It's the realm of supplements. It's the vitamins and and all that. That's really not their area of focus. They're not nutritionists. They're not. They get taught a basic amount about vitamins and nutrition. Last time I checked, this data is probably a little out of date, so it's changed. Maybe it's gotten better. But the last time I looked, of the 129 medical schools, 12 required a single course of nutrition. Now, I hope that's gotten better, but if it has, how much better has it gotten? I don't know. Call it 20? I don't know. But this is the blind spot right here, okay? Antioxidants. What are we talking about antioxidants? We're talking about vitamin C. We're talking about glutathione's a big one. Zinc is not technically an antioxidant, but is part of metalloenzymes that work as antioxidants, at least in the antioxidant pathways, and so forth. Again, I have a whole list of antioxidants specific to deal with COVID. So what are we talking about? We're really talking, if you're talking about complications to COVID, you're talking about IV administration. But again, article covers all that, so don't worry about it. But this is the blind spot, right? I will tell you that the doctors, for the most part, trying to deal with complications of serious complications or people get themselves into trouble, their focus is here. mostly here. This is the inflammatory aspect of the problem. Most of them are very much focused, this is what they try to address right here. And they address that with, well, there was a study that just came out showing that corticosteroids were quite effective. So you have an anti-inflammatory steroid they might use. There's a lot of stuff they will apply this, and they're doing a pretty good job of it too. Again, you know, props to them. But this is where they tend to focus to prevent this. And of course, my point is why don't you go here, start early in the chain, in the pathway, in the cascade, as they would say, and never have to deal with that, because you're at this. By the time you've gotten here, you're already metabolically in some trouble here. Okay. And this is what I'm trying to point out. This is where the blind spot for most of them happens. Again, I have read that there are some hospitals in New York City and so forth that are paying attention to that. They do hook people up to vitamin C drips and stuff, but it's very hit or miss. As far as I am aware, it is not what they would call a standard of care or SOC. That is, you know, as soon as somebody comes in, they test positive for COVID. You know, they're obviously exhibiting symptoms or they wouldn't have come in and so forth. Hook them up to, you know, they don't automatically hook them up to a bag of vitamin C and zinc and glutathione and so forth. N-acetylcysteine is another one you can put in an IV. People can also take some of this stuff orally, but it's not going to be as effective. You know, we're talking about more prevention and reduction of seriousness hopefully seriousness of COVID symptomology, or you might even get through it a little faster. But if you end up in the hospital and all that, you need high-dose IV antioxidants. So this is where the major area, when I say is the medical profession, hence the title of the video, missing a golden opportunity of treatment to prevent ever making your way through this chain of events, that's it. And again, I want to stress strongly, this is not throwing all doctors under the bus, because some of them get it. Some hospitals, I think, get it to an extent. I applaud them for at least throwing a bag of IV vitamin C on people, but there's a lot better ways of going about it. There's much more one could use. I mean, if you plug someone into an IV of C and NAC and glutathione and zinc, and if indicated, a bit of hydrocortisone or whichever steroid you're using, you should see some pretty miraculous effects. I don't, how miraculous or what have you, that's not a scientific term or medical term, so not my best use of words, but depending, obviously that depends on the person, the shape they're in when they come in, you know, and all the usual reasons. But you're going to see a lot of benefits, and you're going to either greatly reduce making your way over here and having to deal with that inflammatory response, which is always a good thing, or you may avoid it altogether. And again, that does depend obviously on a lot of factors of those, the comorbidities, how many comorbidities, how, you know, what kind of condition they are in and so forth. Okay, so hopefully, I don't want to make this video too long, hopefully I've gotten the point across. So the cascade that my model, and here's another thing, okay, I didn't explain the ROS thing, I want to explain this. Where are these coming from? Well, one study that was in, I think it was in Nature, it'll come to me, but anyway, one study that was published thought, or at least their hypothesis was that this comes from the virus attacks heme iron. Heme iron obviously binds iron in the system, keeps it stable, the body can use it. The virus apparently attacks or destabilizes the heme iron, releasing a bunch of free iron. Free iron is extremely pro-oxidative. It's a very, one of the worst pro-oxidants that you could let go into the body, and that's going to cause a massive immune response, okay? So now, however, having said that, there was another paper I read that questioned that the source of the ROS was necessarily from heme iron. Still being elucidated. Why do they think heme iron? There's a number of blood tests and such that indicate that the overload of pro-oxidants in causing this ROS burst is coming from free iron. But be that as it may, it doesn't really matter all that much, honestly, as far as what we're talking about, as far as, you know, helping with the complications. So if one is wondering, well, where is that coming from? One of the major hypothesis out there, I don't know where the data is on that, but suggests it's coming from iron, free iron, which in my paper, I do link to that paper. And again, another paper questioned if that was the source. But personally, I don't even think it really matters. I mean, at this point, not that we shouldn't look at it, not that it shouldn't be studied. Not that we can't learn. If we can target specifically which free radicals and oxidative stress and creating the ROSs coming from, all the better, because we probably could attack it at those very specific spots. But there are not really, unfortunately, as some of you are well aware, that the medical profession, which is getting better about this too. Again, I'd like to, I'll put the props out there, but dealing, basically working with antioxidants, which are quote unquote natural. I hate to use the term, but they are inexpensive, they are non-toxic, and they are cheap as dirt. So that's another plus, I think, in that. Vitamin D, some of you may have be thinking, what about vitamin D? Vitamin D is not technically an antioxidant, but vitamin D is very important to the response of COVID to production of cytokine storm. The body produces lots of anti-inflammatory products from vitamin D down the pathway. So though vitamin D is not really an antioxidant, it's really part of this story per se. Obviously, there's a number of studies now, like half a dozen now, that strongly correlate vitamin D status with the COVID complications and how bad those complications are. Those are correlational studies, so you have to be careful interpreting those as cause and effect. There's not necessarily cause and effect, and there are some studies underway right now, RCTs, that are actually testing vitamin D on COVID and complications. So we'll have more answers pretty soon. So if anybody was thinking D, it's not technically part of this conversation, but you absolutely want to be getting adequate D. In fact, I also wrote an article that they find that African Americans suffer much higher rates of mortality rate from COVID, and I suspect strongly that that is due to their vitamin D status, because African Americans tend to have much lower levels of vitamin D, and between the data on African Americans specifically in vitamin D and the others I mentioned, it's very likely. I'm not going to say it's a lock because data is a little scarce on cause and effect, direct intervention studies, but very likely that the vitamin D status may be at least partially accounting for the higher rates of mortality and complications seen by African Americans, who also tend to have obviously higher rates of comorbidity, diabetes and obesity and so forth. Okay, I think that covers it. I won't try to keep everybody on too long. I hope that helps. If it does, please pass this around to any doctors you know, or if you are a doctor, by all means, check out my article below, ping me for data, sources. I'm always happy to help. I just want to get the info out there so we can get over with this shit. Bring some out.